So we're going to palpate some of the structures of the elbow and forearm, but before I do so, I'd like to ask consent from my patient, so may I do so?
Yes.
Okay, perfect. So we'll start with a posterior view, and I'm going to just grab my patient's arm gently. I'm going to first identify the olecranon, which is this nice bony projection sticking out right here, so we can clearly identify that. If we come just a little bit superior to the olecranon, we'll fall into the olecranon fossa. To check that we're within that area, we'll just passively extend and flex the patient's elbow. From there, we can go back down to the olecranon. We'll work our way a little bit medial, and we'll be able to really fall into this nice little ditch here, which is going to be the ulnar notch, where the ulnar nerve runs. We come just a little bit more medial from here. We can find the medial epicondyle, where my index finger and my middle finger are. Coming back down to the lateral, or to the olecranon, we'll come a little bit more lateral. We'll be able to feel for the lateral epicondyle of the humerus. And then what we'll do is we'll work our way back to the olecranon, come a little bit superior to that, and we know that the triceps muscle runs in this area, and so we can strum horizontally against those fibers. To feel the triceps contract, I'll have the patient extend their arm against my resistance here, so go ahead and do so. Okay, perfect, relax. And I can really feel those fibers of the triceps. So now working with a lateral view, we'll identify some structures. Starting with the olecranon, we're going to identify the shaft of the ulna. So from the olecranon, we'll be able to press into a nice bony prominence here as we work our way distal towards the hand, and that's going to be the shaft of the ulna. From there, we'll work our way back to the lateral epicondyle, and we'll identify the shaft of the radius. And so from the lateral epicondyle, we'll have to kind of press into some of the soft tissues here, but we'll be able to feel for the shaft of the radius, working our way distally until we hit the styloid process of the radius in this region. Going back to the lateral epicondyle, we'll identify that, and then we'll work a little bit superior to feel for the insertion point for the brachioradialis muscle. We know that this runs along the shaft of the radius as it inserts a little bit more distal, and to make this muscle contract, I'll have the patient point their thumb up towards the ceiling. I'll place my hand right here, and then I'll have them go ahead and try and lift their hand towards the ceiling here. Okay, and as they're doing so, I'll be able to strum across the fibers of the brachioradialis as it works its way towards the hand.